Good day, everyone. My name is Dr. Tewa, and welcome to a new episode of Circle Direct Podcast. Now, in line with speaking about kidney health, I would like to start today's episode with a story, one that has stayed with me for a very long time. I had an older friend who told me about this story. So, back in his younger days, a good friend of his, let's call this person Daily. Daily was that guy, very fun at parties, loud, and always up for a challenge. His signature move at the time was downing 20 bottles of beer in one night. It even became a game for him, a badge of honor. And honestly, they all cheered him on. It was wild and they are young. What is it to be young and not enjoy your life? That's what is typically said for people at that time. They didn't know any better. But, fast forward to his early 40s, things changed. Daly started complaining of constant fatigue, his body swelling, and then unexplained weight loss. After several hospital visits, the diagnosis came in: chronic kidney disease. And not just that, he was also living with hypertension and type 2 diabetes. Now, looking back, it's hard not to wonder, what role did all those years of binge drinking play? The truth is, they were damaging their bodies but had no clue. That's why today's episode is so important. We're talking about something that affects millions but is often ignored until it's too late, which is that your kidney health matters. Your kidneys aren't just two waste filters, they're silent powerhouses working 24/7 to filter toxins and waste from your blood and to keep your body clean, maintain your balance, regulate your fluid and electrolytes and minerals, control your blood pressure, helping your heart also stay healthy, and even produce hormones that affect red blood cell production as well as bone strength. But here's the scary part. When your kidneys are damaged, you may not know until it's very advanced, and the consequences can be as serious as it can result to kidney disease such as CKD, chronic kidney disease that is, which can then progress to kidney failure and may require dialysis or transplant. There are also other things like increased risk of heart attack, stroke, and other cardiovascular problems. Other things also include anemia, bone disease, and nerve damage. The good news is it doesn't have to get to that point because you can take control of your kidney health through prevention, early detection, and healthy lifestyle choices. All of these can make a huge difference. A simple kidney function test can help spot early problems before symptoms show up, before it is too late.
Chronic kidney disease, or CKD, affects millions of people worldwide, often progressing silent. So managing CKD before it leads to dialysis is crucial for a better quality of life, as protein metabolism becomes an added burden with individuals who have CKD, as it can accelerate progressive decline in kidney functions. How does this happen? Because protein is the source of nitrogen in the waste generated by the kidneys. Interventions that slow down the progression of kidney function decline and delay the initiation of dialysis for patients living with CKD are essential for a better quality of life. Renastal tablets, a breakthrough nutritional therapy that is beneficial for CKD patients. Renastal combines keto analogs and essential amino acids to prevent and manage the damage that results in faulty protein metabolism. Renastal as a tablet, taken with a very low protein diet, helps slow the progression of CKD, thereby reducing the risk of initiation of dialysis. By replacing essential amino acids without adding nitrogen waste, Renastal can help you maintain the protein balance your body needs whilst protecting your kidneys. Renastal, you are not just managing your kidney health, you are improving your long-term well-being. Ask your doctor if Renastal is right for you, because together we can take steps to protect your kidneys and improve your life. Renastal, helping you live better with CKD. For more information, contact the Seco Direct podcast on YouTube.
As you know, with Seco Direct, we always seek for our patients, so for our listeners, to always be proactive with their healthcare, to do things that will protect themselves in the long run, especially when it comes to kidney. And to help us unpack this today, we'll be speaking to a leading consultant nephrologist with over 20 years of experience, Dr. Umezi Izudike, who will help us understand what a kidney function test is, why and who are meant to do this, how you should look and to protect your kidneys in the long haul, because your kidneys truly, truly matter. We know that kidneys are very important, but as a nephrologist who deals with patients every day, can you help us understand how vital and how important your kidneys are to every person?
All right, thank you for the kind introduction. And the kidneys are big shaped structures which are located in the retroperitoneal space. Breaking it down is just somewhere below your ribs on each side of, just below your ribs at the back. And if you make a fist, each of your kidneys is about that size. And so when the kidneys don't work well, so many other things don't work well in the body. And the vital functions of the kidneys includes the production of urine, and that enables it to be able to regulate body water. So no matter how much water you drink in a day, your kidneys, as long as they are healthy, they're able to excrete or push out what you don't need through your urine. The kidneys also help to regulate the blood pH, right? So if you take some meals that have a bit of high acidity content or alkali content, the kidneys help to regulate that and make sure that it's restored to within a narrow range in the body. They also help to remove products of wastes, all right? What metabolism that your body generates every day. So we're able to measure some of this in the laboratory, which I'll talk about later on. But the kidneys are important in excreting those waste products. The kidneys also regulate uh, minerals like sodium, potassium, calcium, and they make sure that those ions are in the right proportion in the body. They also produce some hormones, all right? So the kidneys produce an hormone called erythropoietin, which is shortened to EPO. And that hormone enables the bone marrow to produce red blood cells. And that's very important. Also, the kidneys produce a hormone called calcitriol. So that is able to help to regulate calcium balance. It makes sure that the calcium in the body is taken in, and the ones that you don't need is taken out. But on most times, it helps you to bring in more calcium into your body and also reduce the wastes in the urine. They also regulate a hormone called renin. Renin is important in trying to make sure that the blood pressure is okay. So, by and large, those are the major functions of the kidneys. That goes a long way in making sure that we are healthy and we um, are keeping well. Then it's important to note that each of our kidneys contains what is called a nephron. A nephron is a functional unit that filters out waste and filters out water. So each of a person's kidneys contains about 1 million of those things. So on the average, about 25% of what the heart pumps out goes into the kidneys. And if you also look at it, the kidneys filters out about 120 liters of water or fluid. But out of that 120 liters, God has so made the kidneys that out of about 120 liters that is filtered out, all right, that should go into urine, the body has a way of reabsorbing over 99% of that. So at the end of the day, you just filter out or pass out about 2 liters of that 120 liters that is produced. Of course, in a condition where you have drank more water, all right, your kidneys will push out more urine or form more urine. In a condition where you have not taking enough water for the day, your kidneys will reduce the amount of urine or water that's passed out. So by and large, the kidneys play a very vital role making sure that we maintain a good health. Apart from the water regulation, it also produces hormones that goes a long way in making sure that red blood cells are produced from our bone marrow and calcium absorption is maintained. Yeah.
Right. Thank you very much for that. Well, say a summary on how the kidneys are silent powerhouses of our body. Now, as the kidney is a powerhouse, what would you say is the prevalence of kidney disease in Nigeria, for instance? Because people often refer to kidney disease as a silent disease because by the time you know that you probably have that kind of disease because of the culture that we have inculcated in Nigeria, it might be a bit too late. So, what would you say is the prevalence, and why would you say that the kidney disease is a silent disease in our landscape today?
All right. Thanks for that question. So kidney disease can be described as the one that usually causes the most harm is chronic kidney disease, right? So chronic kidney disease is presence of damage to the kidneys as well as presence of reduced kidney function that is lasting over 3 months. So there's a damage that we can measure by maybe checking the urine or blood tests. And then there's a reduction in function, which means that the glomerular filtration rate is less than 60 mils per minute. So that's chronic kidney disease. We classify it into 5 stages. There's a stage 1 where the glomerular filtration rate, I'll just call it GFR, okay? Because there's some, yeah, so I abbreviate to the GFR, which is a known, yeah, so it's between 90 and 120 for stage 1. For people who are stage 2, it is 60 to 89. For people who are stage 3, it is 30 to 59. For those who are stage 4, it is 15 to 29. For those who are stage 5, it's less than 15. So those who are stage 5 are almost approaching needing dialysis or a kidney transplant. All right. So when you look at that range, the reason why that classification came about in the early 2000s was to be able to give a uniform nomenclature to chronic kidney disease, okay, which oftentimes is progressive and irreversible. But science is changing that narrative now because we're beginning to see that there are potential therapy that can actually reverse this chronic and irreversible damage to the kidney. Okay, so the staging helps us to say, okay, this person is in stage 1, and all over the world we know what the person's parameters are like to be. All right, this person is stage 2. We know what. So if you look at the world population, it's estimated that about 800 million people all over the world have chronic kidney disease. Not that they're on dialysis, no, but that's spectrum from stage 1, 2, 3 to 5. All right. So the number of those on dialysis of that 800 million will probably be less than, I don't want to put a figure there that's not accurate, but in developed climes, maybe about 100,000 people are on dialysis. All right. And in our environment, we don't have an accurate data in Nigeria. But screenings are usually done on a day that is dedicated to screening people for kidney disease. It's called World Kidney Day. Occurs every March, second Thursday of the month of March every year. It's been on for close to 20 years now. So people have done screening in different parts of the country, and they've come up with a range of about 18% to about 25%. It's a wide range, but that also tells us that this thing, we have seen the early stages, not those on dialysis. No, these are healthy people that you go into the population to screen them for high blood pressure, you screen them for diabetes, you check their urine for protein. And most of those studies have shown that over 15% of our population have any of these markers, either high blood pressure, which is often asymptomatic, or they have some protein in their urine, or they have diabetes. And we must know that the strongest risk factor for kidney disease or chronic kidney disease in our environment is high blood pressure that is not treated. In developed climes, it is type 2 diabetes, right? However, in our environment in the last 10 to 15 years, that picture is gradually changing. You often see a number of people who are on dialysis, they have both hypertension and diabetes because we've changed our pattern of eating to Western lifestyle so that many people consume processed food and that puts them at higher risk of diabetes. So they may have blood pressure, but they also have diabetes. So a combination of those two is the leading cause of chronic kidney disease in Nigeria, right? Of course, there are other causes that we can go into. We can talk about sickle cell disease. Those ones are also at risk. People who have HIV, hepatitis B, hepatitis C, people who have connective tissue disorder like systemic lupus erythematosus or autosomal dominant polycystic kidney disease, kidney stones also, and people who have pelvic tumors, whether it's prostate tumor or prostate benign prostatic hypertrophy that causes obstruction to urine outflow with backflow of pressure to the kidneys can potentially develop chronic kidney disease. Also, in women who have carcinoma of the cervix or ovarian tumors, or even a fibroid mass that is so huge that it obstructs the flow of urine out of the kidneys, can potentially cause backflow and hydronephrosis and then cause gradual decline in kidney function.
But what test would you advise for a common person, a common man to do to get ahead of any of these symptoms arising? Because as everyone is walking around, they won't go to a hospital if they are not bothered. They don't have a particular symptom that they're looking at that they can be concerned about. So what would you advise someone to say, okay, it doesn't have to be that you need to have a symptom. These are the tests you need to do so that you understand where you are at in terms of your kidney health.
Right. So I usually talk about giving yourself a birthday gift. All right. So anybody who's above teenage, 20s, 30s, because we see people that young who are presenting with kidney disease. And you wonder what may have happened. Did they miss the symptom in the early stage? Maybe leg swelling, foamy urine. They didn't really bother. All right. So anybody in that age range, they should watch out for these symptoms. If they have maybe their face is swollen early in the morning, they have leg swelling, or they notice that their urine foams. Of course, if somebody sees blood in their urine, that makes them scared. All right. So such people would have sought help. Okay. So the test that people could do a urine analysis. A urine analysis. So oftentimes when people are sick, they do typhoid and malaria. But they can go beyond asking for typhoid and malaria and just ask for a urine test when they feel unwell. That can pick kidney disease in the early stage. If there's protein that is significant, the person needs to see a specialist to be able to know what to do about that presence of protein in their urine. Then also we can ask people to check their blood pressure. Okay, blood pressure is often elevated when it's often asymptomatic. So unless you check it, you don't know it's there. Okay, so people walk around with very high blood pressure readings and they don't know about it. The only people that maybe will be concerned or may know is those that it gives headaches, but less than 5% of people who have high blood pressure have headaches. All right, so the vast majority don't have any symptom at all. So until people check their urine, check their blood pressure, check their blood glucose, fasting blood glucose, check their cholesterol, do a scan to see what the kidney sizes are like, do a liver function test because when there's kidney disease and they're losing protein in the urine, albumin level is low. So with a liver function test, we can pick that up. From cholesterol, when there is a nephrotic syndrome, cholesterol goes up. So it could be an early indication that this person has some kidney issues because cholesterol will go up either in nephrotic syndrome or some other condition. Yeah, so those are the tests that someone should do. a urine test, check blood pressure, check blood glucose, cholesterol, liver function test, do a scan. Yeah.
So moving on to the treatment, of course. So in our culture, I keep referring to how our culture is in terms of being proactive with healthcare. Another thing that unfortunately has seeped into our culture is the use of herbal concoctions. And I know these usually have a direct impact on the kidney health. Could you expand more and advise the populace about the need to deviate from that style of treatment because it doesn't do well for them. Instead, it pushes them closer to damaging their kidneys.
So in our climb, we have so many people who have access to um, the media, whether it's print media, electronic media, and promote their products. And some of these are even registered, so to say, by the regulatory authorities. But one thing is clear, that the fact that something is said to be effective in treating a condition doesn't mean that it doesn't have side effects. Because even the orthodox medications we do give patients, they all have side effects. All right. So, what needs to be done is to look at, if it is said that our forefathers used all these things. Well, when they used it, they didn't know any better. But in this day and age, there are people who are researching, all right, who can look at a product, look at it to the minutest molecule, and be able to isolate what is effective in those herbal remedies. And that can be used to help to find out what really is the active uh, molecule in this product that is giving these treatments. Right? In that way, you're able to make some advances and be able to know what the effect of this molecule would be on the heart, on the brain, on the kidneys, on the liver, and any other organ. All right. So those are the things that I'm hoping that there will be more funding for research in our climb that will be able to address those things. We're not saying herbal remedies are bad, but we need to find out what is the active components of those things. Okay. So they may have some beneficial uh, effects, but long term. Like every molecule that is being used now to treat people for any ailments, studies have been done in animals. Studies have been done to make sure that those drugs are not injurious to those animals. From that level, it is tested in healthy people. That's phase one. Phase zero is in animals. Phase one is in healthy people to see whether it causes any harm to somebody that is okay. Then we talk about phase two when you try it in a number of people who have the disease you're trying to treat. And that time you're now able to establish efficacy, that this drug is efficacious in treating one ailment or the other. Then you go on to phase three where you're using it in more people who have that illness, and you try to see how many more people you can treat to show efficacy and the fact that it is safe. Right? Of course, there's a phase four that even when the drug is approved by the FDA, NAFDAC, you continue to monitor to see that the drug is not injurious to those who are now using it and using it to treat those ailments. So those are established protocols and phases through which drugs go through before they are approved for use. So if these alternative medical practitioners can just subject and allow um, the experts, work with the experts to see how these molecules can be refined and be tried, I think we should be able to find out which of them is injurious and which of them is beneficial. I don't think we can paint all of them that they are bad. Okay, yeah. Yes, there are some that are beneficial, but if you don't test anything, you can't say this is how efficacious it is. You can't say this is how safe it is. You just have to subject it to rigorous testing, subject it to rigorous trials. And in that way, you can be able to safely say that anywhere in the world, this molecule is safe. Of course, there's also variation in terms of genetics. There are some medications that are very good in Caucasians, but they don't work very well in blacks because our genetic components are a bit different. So if that is established that this drug, yes, it may be beneficial to us blacks, but it may not be beneficial to Caucasians. So those are things that, but generally, I just want to warn people when they are taking herbal remedies that we have not established the efficacy of those things and the safety. So we don't know it could help treat an ailment now, but some months down the line, some years down the line, what is the effect on the person's organs, the kidneys, liver, the hearts? There have been people that took some of these things and they end up in emergency. Unfortunately, some of them don't survive. Okay, so people need to be careful taking those herbal remedies that are promoted to do and cure all sorts of okay.
All right, sir. So, just on a final note, you had spoken about how it's some researchers have stated that chronic kidney disease now could have a reversible component. I don't know if there's any way you could expand on that regarding the treatment that has been stated that could do that.
Right. So, 2010, um, some researchers in the US found out that there's a gene that is responsible for making black people more prone to kidney disease compared to Caucasians in the US. Right? So they were able to identify a gene called apolipoprotein 1 gene. So that APO1 for short gene means that these people who have it, okay, may be at increased risk of high blood pressure, of kidney disease among people who have HIV, even COVID. Right? So that apolipoprotein 1 gene has been implicated in causing kidney disease in blacks. So it's been likened to sickle cell. So sickle cell was supposed to be a genetic mutation that protected sicklers from having severe forms of malaria. So this apolipoprotein 1 gene, the mutation of it that happened is exclusive to blacks. It's not found in whites, except those who have some background of intermarriage with a black race in their grandparents or whatever. Yeah. So it's been implicated that what it's been postulated that that gene protected people many centuries ago from severe forms of sleeping sickness. Right. So the gene protected people who had it from developing severe forms of sleeping sickness. In the current time that we're living in, it's now making people predisposed to kidney disease. All right. So there, there are molecules that are being developed. All right. So we're doing some drug trials in Nigeria now, which is probably the first time a clinical trial in that magnitude is coming to Nigeria to talk about um, a a molecule that can potentially stop and reverse kidney disease in the early stage. All right. So if this drug is administered, it moderates that gene so that that gene doesn't express itself to cause kidney disease. All right. So once there have been some publications done already to show that this drug is of benefit. So once people have the early stage and they are found to qualify based on certain criteria, they can be enrolled in that study and they will be treated with the drug free of charge and they will hopefully have a reversal of their kidney chronic kidney disease condition. And I'm sure that within the next couple of years, maybe 3, 4, 5 years, we should see the results of this drug trial. It's ongoing all over the world, Nigeria, Ghana, UK, US, many centers in all these countries doing the drug trial. And we're hoping that this will change the narrative of chronic kidney disease in Nigeria in the near future.
So, I would like to ask, what's one final message that you'd like for our listeners to know regarding what we're spoken about today? A final message, a takeaway that everyone should know that, okay, this is what I took away from listening to us today?
Okay, first thing is give yourself a birthday gift, and it's once a year. Do a check, right? Check your urine, check your blood pressure, check your blood glucose, check your cholesterol, liver function. All this package will probably cost between 50 to 70,000 or even less than that, depending on which lab you go to. Second message is that salt is not too healthy for us. I'm not sure I got to talk much about that. So blacks have a way of not being able to excrete salt so very well. So let's cut back on the amount of salt we're taking. All right. That will reduce hypertension, that will reduce kidney disease, and goes along, even it will reduce kidney stones. All right. The third thing is try and get to take some exercise. All right. But before exercising, make sure you're reviewed by a doctor, possibly do an ECG to be sure that your heart is very okay before you embark on any exercise. The fourth thing is to try and take enough fruits and vegetables every day. Right. Fifth thing is water intake. Make sure you take enough water. Don't take too much, but before you start taking water, also check your kidney function. So that people won't say water therapy and the kidneys, because of what I explained, when the kidney function goes to as low as 15, stage 5, the water intake needs to be reduced. It's not the same as somebody who's stage 3 or stage 2, stage 1. Those ones can take as much as 2.5 to 3 liters. But once the kidney function starts going down to stage 4, stage 5, water intake needs to be restricted. So you can't say water therapy, no, no, no. Right? And then people that smoke cigarettes, not too healthy, predisposes people to high blood pressure, heart disease, stroke, and all the other things. Then it must be understood that yes, you have staging of stage 1, 2, 3 to 5. But the honest thing is that many people who have early stage of kidney disease may not end up needing dialysis or kidney transplant. They are likely to have heart problem, stroke, or other cardiovascular diseases that can even kill them before they need to do beyond that. So the important thing is prevention. Once you're able to do the tests and things are identified, it's easier to treat in the early stage and possibly reverse some things. Yeah. Thank you very much.
Thank you so much for sharing your time with us. I know you're a very busy person, and I've learned a lot, me personally, as well as I'm sure a lot of people that are listening to us have also learned a lot about how high risk people that are prone to kidney disease, what people should look out for, how important the kidney is to our overall lifestyle, and how we live as people doing our day-to-day activities. And it's been a very, very, very informative interview, sir, and I really appreciate you for giving us the time, sir. And I hope everyone learned a lot from today. Thank you very much for listening to us, a secondary podcast. If you have any questions that you would like for us to address, you can put it in the comment section below, and we'll be able to get to them as soon as we can. Thank you very much, and goodbye.